We've all been taught to think of pain as the enemy, something to be fought, to be silenced, to get rid of as fast as possible. But what if that's all wrong? What if chronic pain isn't the problem at all? What if it's actually a message, and we just need to learn how to listen?
Okay, let me ask you something. You're driving, minding your own business, and bam, the check engine light comes on. What's the very first thing that goes through your head? What's your immediate plan?
Well, you've really got two options, right? You could mask the signal, get under the dash, find the little wire for that annoying light, and just snap, problem solved. Or you could find the cause. You pull over, pop the hood, and figure out what's actually wrong with the engine. The choice is pretty obvious, isn't it? No one in their right mind would just cut the wire. And yet, when it comes to our own bodies, so many of us do the exact equivalent of cutting that wire. We treat the warning signal, the pain, as if it's the real problem, not the message it's trying to send. I mean, think about it. The go-to conventional approach for chronic pain is often to use painkillers to just turn off that signal. Now, don't get me wrong, medication absolutely has its place, especially for an acute injury. But for chronic, long-term pain, relying on it exclusively is just like putting a piece of black tape over your car's flashing light. Sure, the annoying blink is gone, but the engine is still overheating, and the real issue is just getting worse and worse. I love this quote from acupuncturist Ketan Joshi because it offers such a profound shift in thinking. He asks his patients to do something really simple. Instead of saying, "My knee is aching," try saying, "I am aching." That tiny change in language completely reframes the whole situation. It's no longer about a faulty part. It's a signal from your entire system. So what's the big deal? What really happens when we just cut the wire? When we silence the alarm but totally ignore the fire? Well, the consequences can be pretty serious. Joshi shares another fantastic metaphor he learned. He says that taking a painkiller for a chronic issue is like your smoke alarm going off while you're cooking. And instead of checking for a fire, you just grab a chair, yank the battery out, and go back to watching your show. The immediate annoyance is gone, sure, but the fire, it's still spreading. So what kind of fires are we talking about here? That nagging pain signal could be pointing to anything from chronic inflammation to a trapped nerve to even emotional trauma that's showing up physically. When we just mask the pain, we completely miss the chance to investigate and deal with what's actually going on underneath. And this brings us right to the heart of it all. It's about making this one crucial mental shift, from seeing pain as just a symptom that needs to be erased to seeing it as a signal that needs to be understood. This little language trick is so powerful. "My knee is aching" puts the problem in a box. It isolates it. But "I am aching" that acknowledges that this pain affects your sleep, your mood, your entire life. It forces us to look for those system-wide fires instead of just trying to patch up one little part. And listen, this isn't just some philosophical idea. The science totally backs this up. There's a key concept in chronic pain called central sensitization. It's basically a state where your entire nervous system gets stuck in high alert mode. It gets all wound up and starts amplifying pain signals. It's like the volume knob on your body's pain system gets cranked to 11 and then breaks. And that's exactly why a whole person approach is so critical.
Okay, so if we're going to investigate the cause of the pain, what tools do we actually have? Well, let's take a look at acupuncture, because this is something that has moved way beyond ancient wisdom and firmly into the world of modern evidence-based medicine.
This is the big question, right? It's the one a lot of people have. All these analogies are nice, but where's the hard data? Does the science actually show that this stuff works? The answer is a massive, resounding yes. And the evidence is, well, it's staggering. We're talking about a landmark meta-analysis, which is like a study of studies that pulled together data from almost 21,000 patients. Let me say that again, 21,000. This isn't a small trial. This is a mountain of definitive evidence. So, what did this gigantic study find? Well, for some of the most common and truly miserable chronic conditions, back and neck pain, osteoarthritis, chronic headaches, the conclusion was crystal clear, time and time again. Acupuncture was significantly more effective than both placebo treatments and getting no treatment at all. And this wasn't just some quick fix. The positive effects were shown to last. This kind of overwhelming evidence is why major health organizations all over the world, we're talking the American College of Physicians, the World Health Organization, are now including acupuncture in their official clinical guidelines. So really, the debate has shifted from if it works to how it works. And that how is fascinating, It involves helping to calm down that wound-up nervous system we just talked about, and triggering our body's own natural pain relievers. All right, so let's bring all of this home. How can you actually apply this new perspective and start on a different path to healing? What are the real, actionable steps you can take? First, and this is the big one, shift your fundamental question. Stop asking, how do I get rid of this pain? And start asking, what is this pain trying to tell me? Second, find someone who will give you a whole person evaluation, someone who looks at your stress, your sleep, your posture, not just the one sore spot. Third, consider exploring treatments like acupuncture as part of a bigger plan. And finally, and this might be the most important step of all, be patient and compassionate with yourself. Healing from a chronic condition is a journey, not a race. It takes time. And that brings us to our final thought. The next time you feel that ache, that familiar chronic discomfort, instead of immediately reaching for something to silence it, just pause for a second, take a breath, and ask yourself this one simple but incredibly powerful question. What is my pain trying to tell me?
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.